Start taking a multivitamin. If you want to get pregnant, take a prenatal multivitamin every day that has at least 400 micrograms of folic acid. This helps prevent some of the problems a baby can be born with. Start taking the multivitamin at least a month before you start trying to get pregnant. That's because by the time you find out you are pregnant, your baby has already formed many body parts that rely on folic acid and other vitamins to develop normally. It is important not to take too much of any vitamin during pregnancy, especially vitamin A. Show your doctor or nurse the vitamins you plan to take to make sure the doses are safe for you and your baby. Check your diet. In general, try to eat a balanced diet rich in fruits, vegetables, and whole grains. Some foods are not safe to eat during pregnancy. If you're trying to get pregnant, the following can help you stay safe. Do not eat raw or undercooked meat. Avoid eating shark, swordfish, king mackerel, or tilefish because they can have high levels of mercury. Check with your doctor or nurse about the safety of fish caught in local rivers and lakes. Limit the amount of caffeine you have to no more than 1 or 2 cups of coffee each day. Tea and cola also contain caffeine, but usually not as much as coffee. Be careful to avoid germs in your food that could make you sick. Wash your hands with soap and water before preparing or touching food. Wash or peel fruits and vegetables before eating them. Pregnant people should also avoid certain foods that can carry germs. These include deli meats and milk, cheese, or juice that has not been pasteurized, also called unpasteurized. Stop smoking, drinking alcohol, or taking illegal drugs. If you smoke, drink alcohol, or take drugs not prescribed for you by a doctor, now more than ever it is important that you stop. Even small amounts of these substances from time to time during pregnancy could hurt your baby. This includes electronic cigarettes, vaping, or marijuana. It's not enough to stop as soon as you find out you are pregnant. By then, the baby has already begun to form and could be harmed by smoking, alcohol, or drugs. If you need help quitting, speak with your doctor or nurse. There are treatments that can help. If you have any medical conditions, it could cause problems for you or your baby during pregnancy. People who have certain medical conditions should work with their doctor to get their conditions under control before they get pregnant. This includes people with diabetes, high blood pressure, asthma, thyroid conditions, seizure disorders, HIV infection, and other problems. If you have one of these conditions and it is not well controlled, it can cause problems for both you and your baby during pregnancy. If you or your partner has a family history of a medical condition, your doctor might recommend genetic counseling. Genetic counseling can help you understand the chances are that your baby will also have the condition. A genetic counselor can also talk to you about what your options if your baby does have a genetic problem. If you want to get pregnant, it's important to be up to date on your vaccines. This includes vaccines against measles, mumps, rubella, tetanus, diphtheria, polio, chickenpox, also called varicella, and possibly hepatitis.